Good morning, DSN.
Good morning, DSN. Good morning, Sabia.
Good morning, Jane.
Thank you for coming. In fact, I would like to share with you my good friend, Sabia. In fact, I met her in April. She came with a medical report, which is MRI from Gleneagles Hospital. And when I look at the report, it was in fact bad news. It's confirmed that the daughter is having tongue cancer. So today I would like to interview Puan Sabia. When did her daughter started to have problems? So Puan Sabia, I would like to know, when did you notice that your daughter's tongue had problems?
Yeah, end of 2009, I think because of her braces, the end aging of the braces always got hooked on her tongue, yeah, and at the same time she loved hot food, hot soup and chili, yeah, and after a month or two, that was about in end of February,
Yes.
she complained that her tongue swollen. Then I applied RGGL powder on it, and after a couple of days it shrink. Yeah, there's no more swollen, but it shrink like a dead meat, dark color, and in it was March. She went for an appointment with doctor in Gleneagles, and they advised us to go for operation because they say it was just a normal trauma ulcer, nothing to do with cancer, because doesn't show any sign of cancerous problem. It's just a trauma ulcer, so she just need to stay in the hospital for 5 days for the operation, and she can't speak well after that, can't eat much, but I continue, of course I continue her with RGGL just in capsule form, and then with, what you call that, this soya,
The soy, the milk?
The soy milk,
Nutrizi?
Nutrizi. Yeah, Nutrizi has her breakfast, and then Spirulina and RGGL. But after the third week, when they send the cyst for test biopsy, and the doctor called and says that it is it's a tumor. She needs to come and see the doctor for further discussion on another operation. And when she went there, they found also lymph node. There's some like small beans according to the MRI.
Yes, it's about
two beans like green peas size.
According to the size is 1.3 times 1.
One is 1.3.
Yes.
The rest are just like green peas.
Yes.
Yeah? It's like chain. Yeah. Over here. So she need a very major operation where they have to take some of the tissue from her hand to replace half of the tongue that will be operated, and also on the neck it will be, it will look very bad for her, because they don't think they can save the normal neck. Maybe half of the neck gone. Yeah, half of the flesh on the neck will be gone. So I did ask doctor for a few months time for me to go for alternative medicine. Then the doctor refused to allow me that, because he said by then, the third month, if I come and see him, it will be the whole mouth swollen and the whole neck might be gone after that.
Okay. So at that time when they came to me, you did consult the oncology because you refused surgery. So you asked the oncology to start with chemotherapy. What did the oncologist tell you?
They refused to start with oncologist. The oncologist refused to go with radiotherapy or chemotherapy, because the operation need to be done first. Yeah, then only they will advise her on chemotherapy or radiotherapy. Of course, as a mother, I have the instinct that she will be okay.
Yes.
And when I called Sister Jane for advice, because of her experience with her father, prostate cancer, And I told my daughter to go through her website, RTJ's website, and say, you just go through and then you make your decision. If you feel that you have the confidence, because you are big enough to make decision on your life, and I just let her choose, yeah. But I told her I have faith. I have faith that she can recover without an operation. And she did call you, I think.
Yes.
Yeah.
So according to the medical report here, she had a lump on her tongue. It was 3.5 times 1.2 centimeter.
Yeah.
And as you said, she had a couple of lymph nodes, at the neck. So when I look at the report, none of the organs is affected.
Yeah.
So I was quite confident that I can give her mega dosage of the DSM products. So that's why I started with her treatment. I recommended 2 packets of Mycovita a day.
Yes.
1 packet in the morning,
yes,
and 1 packet in the evening.
Yes.
And each packet you top up with 1 bottle of GL powder, right? Okay.
Yes, yes, sir.
And with that, we put in a bowl, and you add 30 ml Cordypine and 30 ml Morinzhi,
yeah,
and make it into a paste.
Yeah.
And you let her suck the paste,
yes,
throughout the day,
yes,
and finish the 2 packets of the product within the day. And what was the reaction that your daughter experienced during the Ganoderma treatment?
When I say, oh, it's scary, but actually it's good. Yeah, nothing that can heal without pain. Yeah, everything that need to heal, you have to go through pain, but a positive feeling actually, because first thing, her history, health history, she had epilepsy when she was 16 years old.
Yes.
And in fact, doctor say whole life she need to take medication whole life, and there's no guarantee that she can be cured. But in year 2000 when I met you,
yes,
remember?
Yes.
I tried on her with just normal RGGL,
yes,
and her epilepsy stopped. No more attack. She doesn't need to go and see doctor anymore until.
How long after she took RG and GL?
After 3 months.
3 months.
3 months.
That's good result.
No more attack.
No more fitting.
No more fit. Yeah, she was healthy. She can go to normal. In fact, hardly take any MC in a year. Even her body system, immune system was weak. Difficult to get flu and fever as well.
Very good. Okay.
And I was thinking that the epilepsy problem gone.
Yes.
But after she took Mycovita,
yes,
on the first week with GL powder and Cordycep and the rest,
yes,
yeah.
What was her reaction?
The first few days she feel that the head was like banging with hammer.
Throbbing.
Yeah. She feels so painful. She can't even
sit up.
She can't even rest properly. But I told her it's normal because you have problem earlier. Many years ago you have problem. Actually, that problem has not been fully recovered.
Yes.
Yeah, it's not fully recovered. So RG, as we know, RGGL in Mycovita, it works to repair the whole system of your body.
Yes.
So it goes to the head, to the brain, where your brain had problem. So it goes. In fact, doctor also was surprised how she can stop medication and she doesn't have the epilepsy attack. And then she don't need to go for every 6 months. You have to pay about 1,000 for her scan. Yeah, to check whether there's any tumor. And then she, for a few days, for almost the first week, she had severe pain, head pain. And after that, the second week, she had problem with her tongue, like as though it's getting bigger, smaller, shrinking, bigger. Expand, yeah.
Expand and shrinking.
True. And then the third week, also her sinus, which according to the MRI report,
sinus.
They found polyps.
Polyps?
Polyps, on her cheek due to sinus problem. Surprised her. She is not a sinus problem patient. She hardly sneeze.
Yes.
But they found polyps there. So she feel the whole face now. The brain will feel better, no more headache, but her face, her tongue is already, the effect is there. Even with the pain during the daytime, but it's miracle. At night she can sleep well. Yeah, she can sleep well. Even she wake up to pass motion or urine, she can go back to sleep.
Oh, that's good.
And very soundly sleep. She had good rest.
Yes.
The next day again she will be taking, like what you said, use the paste to suck, to put on her tongue,
Yes.
and then Spirulina and lion's mane, in the morning before breakfast.
Right.
So her meal, of course, I try to control her meal as well. No oily food, no chili, no spices, all steamed food, and more fruit juices, fruit juices, like apple, tomato, or carrot juice, things like that, and together with our miracle product of DSN.
Okay, Puan Sabia, I remember I call you quite often and call your daughter quite often.
That's right.
And I would like to know, when did you notice that the lump has become smaller and the lymph nodes is gone?
Okay, the lymph node doesn't gone overnight. It goes smaller and smaller until you can't even notice anything there.
And how long did you take?
It takes about 3 months for the lymph node for you for it to visible. For the tongue, from the uneven surface, it takes about 2 months for it to go back to normal level.
Yes.
And the aging, where they had the operation to get rid of the dead meat.
The operation site, yes.
It start getting pinkish. Although in a week, once or twice, I realized that they have a bit of a white spot. White spot is a sign of the cancer.
Yes.
But I told her not to worry. The pinkish side, the aging side, will become pinkish, which means there are new cells coming up.
Yes.
I told her.
Yeah.
So as long as she be patient, just continue. Of course, after the second month, complete the second month, the third month, no more pain in her body. Otherwise, she'll be feeling, even on the during her admission, they jab her or injection, whatever jab that she had, it was aching. Even on her hand, it was blue back because wrongly injection done by the nurses. But after that, it was very painful. But after the second month complete, the third month she feel much better. No more aching, no more headache, no more. And the first month and second month, she start going to toilet quite often, pass motion 6 times a day. Urine, of course, more than that.
Is it normal stool?
The stools are very dark. I think I told you and you explained to me that it was full of toxins. And of course we never give up, because as long as there's a positive progressment, we should continue. And until today, the aging are totally, completely 99% healed, back to normal. And I'm very happy for that.
That is how long after taking the products?
Well, she start taking full dosage. Full dosage
in May.
In April.
In April.
April. Until today.
Yes, 5 months.
5 months. Everything can be considered 99% recover. But she told me yesterday, she said, I'm not going to stop with this treatment until I complete a year, because my sickness, I don't think it was there overnight. So it must be in my body for a long time. So I'm going to continue for a year. After that, I'm going to just continue with Mycovita and the rest, but in a lower dosage. So
has she gone back to work?
She has gone back to work.
And she's preparing for her wedding?
Yes, that's
which
right.
Which is a wonderful moment.
She's very energetic. Yeah, she's very energetic. And in fact, when I told the boss I'm sending her for MRI, the boss said, through my own naked eye, I can see that she's 100% recovered.
Yes. In fact, she mentioned to me the other day, she said, Auntie Jane, DSN has wonderful products for cancer, but why somebody refused to believe?
Yes. She's been asking me the same question.
Yes. So I answer her, those are blessed by God, they will have the chance to take DSN products.
I just want to tell the public, or anyone who want to try DSN, please do not hesitate to try, because no doubt you're going to have physiological effect, there will be pain and so on, but you must have the confidence, because the product is not just to stop your pain, but actually to recover and repair your whole body system and make you a healthier and happier person.
Okay, with Puan Sylvia. Now, since your daughter is really having a good effect from these DSN products,
yes.
So today I would like to explain to you why this range of products over here works so well for your daughter.
Yes, yes.
In fact, from my past experience in oncology, the contributing factor in our body environment can encourage cancer cells to survive. So the best product that we are giving to balance the pH of the body is Cordypine and Morinzhi. So that you are giving your daughter a lot. I know you're giving 30 ml about 5 times a day.
Yes.
Yeah, to balance the pH of the body, number one. And secondly, we are giving your daughter high dose of RG and GL because your daughter's organs is not affected. So in fact, I'm not worried when your daughter have that reaction that you are explaining to me. The lump become swell up and reduce in size, and that is a physiological reaction because the RG is a scanner.
Yes.
So when it detects cancer, what algae will do is you will open up all the blood vessels, okay? And then with GL contains a lot of polysaccharide. It will activate our immune system because when our interferon level is high, all the immune cells are very aggressive, including the NK cells, the macrophages. So the immune system will go through the patent circulation and they go directly to the site of cancer and they attack the cancer. So that's why you can see when your tumor is flooded with circulation, blood circulation, and the lymphatic system, that's why the whole lung swell up. So when they kill the cancer cells and you have to eliminate the toxins, it reduces in size and then it's flushed out to your circulation and to your systemic function through urine or even your intestine to eliminate all the toxins. So in fact, repeatedly you can feel that the lump will increase in size, reduce in size. That is because of the healing the process of healing of the cancer. And moreover, this GL contains a lot of organic germanium. And organic germanium can increase the oxygen level in the body. When it increases the oxygen level in the body, the cancer cells cannot survive. So now the 4 principles I want to explain to you. Number 1, balance the pH of the body, improve blood circulation, enhance immune system, and increase oxygen level in the body. So we are eliminating the environment for the cancer. And there's one more thing, I have read a lot of articles. The cancer researcher, they have claimed that the RG contains tryptophan. And tryptophan is the bitterness of the of the Ganoderma,
yeah.
and that one would interfere with the enzyme in the cancer. When they interfere with the enzyme of the cancer cannot survive. So it would dry up.
Yes.
So that is direct killing of the cancer.
Yes.
And at the same time, Morinzhi has a special effect that is will cut off the blood supply from the cancer cells to the body. So the cancer cell is deprived of nutrients. So it can cause apoptosis. That means it's the death of the cancer. So you can see
survive.
Correct. So this range of products, it has direct healing effect and indirect healing effect for cancer patients.
So, but she went again another website where this cyclist, he was diagnosed third or fourth stage. Then he went cycling all over the world and recovered. So that's also part of the determination from all the stories to make her take this product instead of going for the operation. Which means it can be healed.
Yes.
As long as when she was in pain, I told her she wanted, Mama, I cannot take it anymore. I don't want this product anymore.
Headache.
Headache and then pain here, pain there. I told her, look, it's your life, because I don't want to manja her. If I manja her, I said, she become lembek. So I told her, look, you want your cancer to win, or you want to be a loser? You want to be a loser and let your cancer win this battle, or you want to be the winner? Which one now? It's in your hand. You have the product, so good. If you refuse, I cannot help you anymore.
That's why Mr. Teo, you can see, going through the Ganoderma is not that easy. She's only on the tongue, and that reaction she's having because of her epileptic, So it goes to the brain first.
Everywhere, she always wear high heels. Her shoes are all 3 inches. Just like model lah. So she always sleep her leg.
Kaki sakit pula.
Then also, like I told you, the first 2 months, the whole body here,
Semua tak kena.
all painful. It's all because of it goes and repair your vein, blood vessels. Then she realized, actually I have a lot of problems in my body. Medicine that can heal without pain. No, you cannot.
No pain, no gain.
No pain, no cure, no gain. Betul? Although it's the taste is not that good, it's a bit bitter, it's a bit sourish, but at the end of the day, I say no doctor in the world can really heal you from head to toe like this and product can do for you.
People have requested, why Dr. Lin cannot give nice taste products?
If it's tasty, it's not medicinal value. It doesn't have medicinal
value. So clever.
If it's tasty, it's not medicinal value. It's poison. So it's up to you. You want poison or you want healthy food? To me, money you can find, but health is not easy to get. I think partly because Sophy has been taking RGJL, although it's not in big dosage, but I think it helps. That's why when she takes this, the recovery was quite fast. Because it's already in her blood vessels. Her body system already.
I want to interrupt. Just now you said why she's taking small dose, and then your daughter can benefit. I want to share with you. My father had stroke in 2001. He had stroke, and then he took 5 pens for many years. Then he had cancer in the year 2007. So what happened was when I noticed why his cancer is not spread, to other organs. It's confined to certain area. The RZ has the ability to confine. It will hold the cancer together, so it will not go out. So even small dose, it will not go out to other places. So it's called metastasis. So that's why RZ is very important in our daily life. Even small dose, it will block the cancer.
Even the Japanese research done, the same report was in the website.
with our lifestyle,
Our
the food,
yes, environment, pollution.
the LGGA is trying to suppress our fire. Here you're burning your own fire. Your fire is bigger than the LGGL, so it cannot suppress. But still, it
Water
confines the
pollution,
cancer.
stress.
Yes. So it confines the cancer to a certain area, you know. So the protection for RG and GL is definitely there.
My daughter thanked me for giving her RGGL, although it was in small dosage.
Yes.
Because she says that maybe already immune to her, when she takes it, it works faster.
Yeah.
Heals better.
Yeah.
So she said, pity for those who have not taken RGGL. Money is not everything, but
Yeah.
most important,
Yeah.
when someone recover
Yes.
from a very serious sickness,
That is the satisfaction you get,
the
lah.
satisfaction
Yeah.
is there.
Yeah, we get
if we can help them.
It's true.
But number one, to convince them.
Yeah, it's true.
But Jane convinced me to take this product with very full of facts and figures, so it impressed me. Not just because like normal health product, you say you take this lah, good for your diabetes. You take this good for your hypertension. You know, things like that. No, she just told me take RGGL. Then
Medicinal.
I asked her
Why?
how it works, because I'm that kind of person. That's why for the past many years I put all our children's life in the hands of doctor, but now no more. Since I know the extent, I told the doctor,
I
my
know.
son's life is
You're very
in their
blessed
hand.
with a wonderful mother.
I think he was so quiet and stunned when I told the doctor, I don't put my son's life in your hands, doctor.
You're so daring, huh?
Yeah, I told him, you have no right to say that he's going to die if I take him out.
Yeah. I remember he told you that, huh? No.
He has no right
Poor
to say
thing,
that.
doctor sentenced you to death.
You see? So even if he goes out now, back to the hospital, the doctor will be surprised.
Yeah.
Hey, Anwar.
Your daughter is going to surprise all the oncology also.
Yes, in fact,
The oncology expected her without treatment would be like that.
yes, and her tongue will be out.
How many months, 5 months,
So now I told the boss, when can she get a leave? I want to take her for MRI. No need. My naked eye, I can see she's 100% recovered. In fact, she can work in the hotel, make nice, what you call that? Those hard drink.
Yeah.
Because she's been shaking.
Shaker. I didn't bring my shaker today. Yesterday we had cocktails, How many times we drinking?
She's been shaking this one and this one. And also those maybe left a bit from Mycovita, she will add in and
no waste.
no waste. So thank God lah, and thanks to the founder of the product.
Yeah, actually, Mr. Teo, you see, our cancer treatment, those without medical treatment, they recover faster. Because those who go to chemotherapy, their immune system will be suppressed. You have to push it up again. It takes time, Unless those people already have basically been taking our product for some time, then like Rita, so it will not suppress our immune system to a critical level. Yeah.
She has been taking RGGL.
Yes.
That's the reason why doctor, when the first time saw her tongue, said it's just a trauma ulcer. It's not cancer.
Yeah.
Because doctor say if it's ulcer, if it's cancer, it's not like,
Look like that.
it doesn't look like that.
That means
it
your
becomes worse.
That means your RGGL already healing,
Yeah.
Healing on it,
But it was not
Enough dose.
enough dosage. Yeah, that's all. So now at least she appreciate the product. It's not easy for me to explain to my children, to convince them to trust the product. You see, now she herself says, okay, I will talk to my friends. There are a few friends who wanted to try. They say, I'm waiting for your report. Normal people, they always want to see black and white. I want to wait for your report. Once your report is okay, I don't care. Doctor don't diagnose me anything also, I will still take to clean my body. Most of the oil and gas engineers were telling her.
Okay. In fact, I had one testimony. Remember when I first came into the young accountant, also 28 years old with breast cancer. Till today, she's never off a micro diet. She delivered a beautiful baby girl. She off tamoxifen after 4 years. She refused to take medication. So no relapse.
No relapse.
No relapse. She only have.
The same goes to my daughter. She says she will continue.
It's worth it.
It's worth it.
Health is the investment.
Where is she working right now?
Onyx oil and gas consultant. And thank God lah, she also managed to get a good boss. The boss says she can come back to work whenever
She's on MC for how long?
MC just for that 1 month. After that, she needs to go for operation. They don't continue with the operation. No more MC. Just
no pay leave.
No pay lah. But still, the boss give her half of the month pay. Every end of the month, her account she check in the internet, got money.
Not bad.
The boss said no, I still give you. You know, it's good lah.
Yeah, but Mr. Teo, you know how much money they spend on the products? About 5,000?
Yeah, 5,000 a month. But it's worth then throwing another 100,000 for the operation, although the insurance covered half of that. But what do you have guarantee? Even doctor, when I ask what assurance and guarantee can you give us, whether she can really recover, 70%, 80%, you know, that's all. So why should we go and take the risk? And we only need few months to test on this. I'm not going to tell her, okay, you continue 3 years, 4 years, no need. Just few months you can see the result.
Yes. Then you maintain about 12 tests to do.
No, she says she just continue Mycovita, Cordypine and Morinzhi. So, good lah, I don't have to convince her anymore.
Good morning, DSN.
Good morning, DSN. Hi. Good morning.
In fact, I'm so happy to have Puan Sabia, your daughter, to be here this afternoon.
Yes, thank you.
Okay. So, I would like to ask your daughter, when did she find that her tongue start to give her problem? Sophy, would you like to share with us what was your problem?
So should I just mention that how does it started? Okay,
Cannot hear.
I think it started somewhere after I came back from holiday.
When was it? October last year?
Okay. So it started swollen, but I just ignored it until middle of January. Then it started to become bigger and it's more painful. So, but I just keep quiet because I thought it's normal ulcer until March. I keep it until March. Then I inform my parents about.
But before that, we put RGGL.
Yeah, before that we only took normal dose of RGGL. Not RGGL, but
RGGL powder.
RG. We only take RG, no GL.
Just put on the wound?
On the wound.
Okay.
But the
swollen part.
Swollen part.
It tried to heal by itself, but it couldn't because
it just shrink.
The wound is too big.
Yes.
So without GL, it doesn't work.
Okay.
So until I was admitted in April, early April, first week.
Yes, correct. Yes.
Then I met with Auntie Jane.
Yes.
And she recommended me to take this dosage.
Okay, all right. In fact, the management of the hospital part, your mom already explained to us. Now, I would like you to share with us the products you're taking. Especially, I recommended gel. This is Mycovita, one sachet, one morning and one evening,
yes,
with 1 bottle of gel powder,
together with
Cordypine 30 ml and Morinzhi. And what was your reaction initially?
Oh, towards the first 2 weeks, oh my God, I can imagine, it's so terrible. I couldn't imagine that I still alive until today.
You were suffering.
The physiological effect was too bad. I could not stand it. But lucky I have a mom to support me. And
but one thing, you sleep soundly every night.
How bad was the reaction? Your pain in your head?
Pain every part. Okay, first few weeks, 2 weeks, first 10 days, my body start aching, and it start from my leg until top, until my head. I feel so heavy. The head feels so heavy. I feel like hammer banging. Yeah. So But my mom asked me to just be patient, relax. It's normal physiological effect. It will be reduced. The pain will be reduced from time to time.
Yes.
Then, but the best thing about after taking this, my appetite start coming. You know, like I eat a lot.
Okay.
So that's good. Although I still have the pain.
Okay.
But coming towards the 1 month plus, I started feeling better.
Okay.
But a bit weak lah, and I can't go to work still yet. So I took 2 months MC. But after that, starting from July onwards, I feel very, very healthy. And here am I today?
Yes, and in fact, I can see that you're very healthy today. But I remember when you started your this range of product, that was in late April.
No, mid of April we already called you before.
I see. Okay, correct.
No, we started taking on the 28th.
Bukan mid-April.
Yeah, I remember you brought this MRI result to my house, and I started to, because I was very sure that she only had a few lymph nodes involved, and none of the organs is affected. So I'm very confident. That's why I give her very high dose of the RG and GL, which is in the Mycovita.
If I'm mistaken, is only one pair.
One pair starting 28 April.
Yes.
And I started 2 pairs of Mycovita starting from 8th of May.
8th of May.
This year.
Yeah.
And when I started on the 8th of May, the double dosage, it was really not really bad, but I feel tired.
Yes.
And I feel like giving up.
Yes. And the way you explained, because I call you quite often, you said your lump was expanding, squeezing.
It's expanding. Week 1, like a ping pong ball, and then it's slightly bigger towards the following week, and then after that, I think it's already to the max of the size. So it started shrinking.
Actually, it was not physically ping pong ball, but she felt
it was.
She felt that
it was enlarged.
Yes.
And it started shrinking. Every day it will shrink a little bit. But first 3 days after it expand the size, it shrink 50%, and then after that it doesn't expand that much. It little by little. I got per day. Yeah.
Yes. Okay.
But of course, as you see, I'm not very patient kind of person, so I want to be healed very fast.
Yes.
Okay lah.
Okay. In fact, Puan Sabia, I'm very happy with Sophy's result at this moment, because before she started this range of products, I examined her myself.
Yes.
She had a few lymph nodes at her neck, and then also the lump at her tongue was quite huge. Yeah, but again, after how many months she's taking? 5 months?
Yes.
After 5 months she's on this product, I examined her again just now. There's no lump on the tongue, and there's no lymph nodes. Yeah, so I must congratulate you for being so confident with the products, and you are well today, and she's getting ready to be a new bride. Yeah, so I'm very happy. So what we should do now is you continue with the
Who would
product.
you like to thank first of all? Beside God?
Thank God, thank our God first. Thank our God first, huh?
And after that, the most important,
The exam.
Yes.
now you have
Definitely.
full confidence in the exam. Before,
I just take it as normal, like vitamins, like my normal food supplement. That's it.
Yes. Okay.
so now you have full of faith and confidence in the exam.
Yes.
That's good. At least one of my burden to remind you to take the exam is gone.
Yeah. So just now I was explaining to your mom about the medicinal principle about this range of products. Since you're here, I will repeat what I said just now. In fact, this range of products, they have indirect healing and direct healing on your cancer. Alright. Now I will talk about the direct healing first, because in fact this Mycovita contains about 30 Rg and 30 GL. So I'm giving you high dose. You are taking 2 sachets, and on top of that you are taking extra 30 grams of GL, you see. So what can these products help you? The direct killing of the cancer comes from the tryptophan in the RG, because it interferes with the enzyme in the cancer, and then without the enzyme in the cancer cells, the cancer will die. Okay, that is directly. And the second part is the polysaccharide. It will enhance your immune system, so your immune system become very aggressive, especially the NK cells and the macrophages. They will go directly and attack your cancer, and your cancer will die too. That's why our God gives us a very good body, because we have our immune system. Because due to our diet and our lifestyle, our immune system is not strong. Yeah, when you feed your immune system with the right food, your immune system can work for you. Okay, and at the same time, this GL powder also contains organic germanium. It will enhance your oxygen level. When your oxygen level is high, cancers cannot survive. Okay, and at the same time, you also take Cordypine with Morinzhi, and that will balance the pH of your body, because whatever food we eat today, majority of the food is acidic. And on top of that, you have stress. Okay, so when the body is acidic, and cancer will tend to, spread in your body. But if you eliminate all these breeding ground for cancer, number one, balance the pH, improve blood circulation, enhance the immune system, and good oxygenation in the body, well, cancer cannot survive.
And what about Spirulina and lion's mane?
Okay, this is a good question. Now, Spirulina is a complete food. It contains all the nutrients you need for your body, because whatever food you provide your daughter, it can never be balanced. So you will still lack of certain nutrients in the diet. So this is a complete food, and you will not have to worry whether you're giving her enough protein or calcium or vitamins, etc.
Or vegetables.
Yes. So you are taking 30 tablets. 30 tablets. That is sufficient for our whole day supply. Now, you don't forget that Spirulina is an alkaline food. It's alkaline food, and of course, whatever nutrient here, it will not upset your pH. And moreover, the beta-carotene in the Spirulina has anti-cancer activities. And also Spirulina contains a lot of polysaccharides. It can enhance your immune system. And don't forget our DXN Spirulina we cultured in Malaysia, in Alustar, where we get a lot of sunlight. So the chlorophyll content in our DXN Spirulina is so much higher than other brand. So the chlorophyll, it can normalize your cell function. So you can see that this is a very good food for us, and you can it's good food supplement. At the same time, it has anti-cancer activities.
One thing I need to add. Last time before I took this product, I just took normal dosage, which is RGGL 2 pairs a day, and still my boss said that I look pale. Okay, but after taking this, it doesn't complain anymore.
You're pinkish. So you see, as I mentioned just now, it contains complete nutrient, from vitamin B's to iron, etc. That means you can manufacture your own red blood cells. And moreover, because of the high content of chlorophyll, your body is able to rebuild new red blood cells at all times. So when the body can produce new red blood cells at all time, it rests your spleen and it rests your liver. So of course you will be very healthy. All right. And why I'm giving you lion mane? Lion mane contains a lot of polysaccharides, and it has also anti-cancer activities in it, especially for gastrointestinal cancer. Gastrointestinal means from oral to your throat, esophagus, stomach, intestine to the colon. So you can see, and at the same time, because you had a bit of surgery under your tongue, it affects your nerves, and this lion mane also help to heal your damaged nerves. So whatever you're pulling, your pain under your thumb is because certain part of your nerves is being damaged. So this is very good for healing. Okay, Sophie, I can see that today you shared your tears with happiness because you're getting married soon, right? Okay, so congratulations, and I would like to ask your feelings because Auntie has asked you before, this range of product is so good for cancer patients, including yourself, and what is your advice to cancer patients out there?
First of all, don't give up. Although the physiological effect of this product at first, beginning, is difficult, it's very painful, but it's only lasted you for a few days or weeks. It doesn't take you months. And then this product is very healthy, so it can cure everything from top to toe. So not only what illness that you're having, but it clears everything that might have no
symptoms, problem without symptoms. Yeah, okay. And mother, what is your advice to the public regarding your daughter's success?
Yes, thank God for giving me this product through Sister Jane.
Although it's slightly expensive.
But I think when you talk about money, the cost of operation, chemotherapy and radiotherapy will cost us more and more painful, and there's no assurance or guarantee from doctor that normally after going through all the process that you can recover 100%. So what I advise is for those who have not tried, give a try, because especially for Muslim, not to worry, because all the exam products are with halal certificate, and don't have doubt about the effect, because it will be 100% recovered, provided you have the faith and take it accordingly as advised. And what you can do is pray a lot, and at the same time relax yourself as though you're enjoying the product like your normal healthy supplement food. Result will be good, I can assure you that.
The most important thing is believe in yourself and this product.
Okay. And my advice to the public is prevention is better than cure.
Yes.
Because in prevention, you only need to take a few capsules of the RGGL and about 30 ml a day, Morinzhi and Cordypine, and a few tablets of the Spirulina on a daily basis to balance pH in the body, improve blood circulation, enhance your immune system, and increase oxygenation. Yes. But the problem with the public is they do not see that health is an investment. So when they have problem and come to you, and especially when they have cancer, they come to me and told me that the product is too expensive and they can't afford it. Then nothing is free on this earth. If you can't spend about 300 ringgit or 400 ringgit a month for prevention purpose, definitely when you have health problems like cancer, you come to me, you need about 4,000 to 5,000 ringgit a month for the treatment. Definitely you can't afford it. So I emphasize on prevention is better than cure.
Yes.
It's just like your vehicles. After 5,000 miles, you will go and service your car. But if you don't service your car, when your car breaks down,
it costs more.
It costs more. And that is my advice to everyone. Thank you.